Before this video reaches 60 seconds, I want you to do something. Reach up with one finger and gently pull down your lower eyelid, just enough to expose the inner rim, the moist pink tissue that lines the inside of the lid. Look at it in good light. Natural light if you can. What color is it? If it is a deep, saturated pink or red, that is one result. If it is pale, washed out, closer to the color of your fingernail bed than to the color of healthy gum tissue, that is a different result. And if it is nearly white, if there is almost no color in that tissue at all, that is the result that I need you to take seriously today, not next week, not at your next scheduled appointment, today. Because what you are looking at when you examine that tissue, which is called the palpebral conjunctiva, is one of the most direct and accessible windows into the state of your blood in the entire human body. And the color you see there can tell you things about what is happening inside your body that a standard annual physical will often miss entirely. I am Dr. David Miller. I have been practicing medicine for 15 years, and I built this channel on one principle. The signs your body is sending you right now, the ones that should be prompting investigation and action, are almost never explained to you in the 12 minutes your clinic appointment allows. That is what I do here. Subscribe to Dr. Miller right now and hit that like button. We are building a community of people who use their own bodies as the diagnostic instruments they actually are. Every subscriber makes this channel more visible to the next person who needs it. The palpebral conjunctiva, the inner lining of the lower eyelid, is one of the few places on the human body where capillary blood is visible with no skin or significant tissue layer between the eye and the blood. The conjunctiva is a thin, transparent mucous membrane. When it lines the inner eyelid, it is draped directly over a dense bed of capillaries with almost nothing obscuring them. The color you see is the color of the blood in those capillaries, specifically the color of the hemoglobin in the red blood cells circulating through them. This is why clinicians have been examining the inner eyelid for centuries as a rapid assessment of blood oxygenation and hemoglobin concentration. It requires no equipment, it takes 3 seconds, and it has a clinical sensitivity for anemia that compares favorably with a cursory visual examination anywhere else on the body. Let me tell you about a patient I will call Dorothy. She was 68 years old. She came to see me for what she described as a general feeling of not being right. She was tired. Not the tiredness of a bad night's sleep, she was clear about that, but a heavy, persistent exhaustion that did not lift with rest. She was cold, particularly in her hands and feet, in temperatures that did not bother other people. She was short of breath, climbing a single flight of stairs, which she attributed to being out of shape. She had been living with these symptoms for approximately 7 months and had told herself repeatedly that they were simply part of getting older. When Dorothy sat in front of me and I conducted a basic physical examination, the first thing I noticed was what I noticed before I said a single word. Her lips were slightly pale, her nail beds were pale, and when I asked her to pull down her lower eyelid, the conjunctiva was almost white. Not pink, not even light pink, white. I had the answer I needed before any blood test had been ordered, and the blood test that followed confirmed it within 24 hours. Dorothy had a hemoglobin level of 7.4 grams per deciliter. The normal range for a woman her age begins at 12. She had been walking around for months with a hemoglobin level that in a hospital context would typically prompt a blood transfusion conversation. Her body had compensated so gradually that she had adapted to it without recognizing how profoundly her function had been impaired. Her heart was working significantly harder than it should to deliver adequate oxygen to her tissues. Her brain was receiving less oxygen than it needed to function at full capacity. And every single day this had been visible in her eyelid, waiting to be read, and nobody had looked. I want to use Dorothy's case to walk you through the full diagnostic picture of what the inner eyelid can show, because pallor is only one of the findings, and some of the others are equally important and equally overlooked. The first and most clinically significant finding is pallor, which I have already introduced. Let me explain the mechanism more completely so that you understand not just what it means, but why it appears in the eyelid specifically and what it is telling you about what is happening at the level of your blood. Hemoglobin is the iron-containing protein inside red blood cells that carries oxygen from the lungs to every tissue in the body. It is also the compound that gives blood its red color. When hemoglobin is present in normal concentration, the blood flowing through capillaries is a rich red. When hemoglobin falls, for any of the reasons I will describe, the blood becomes progressively less red, pale. The capillaries are still there, the blood is still flowing, but the color is gone because the molecule that provides the color is depleted, and because the palpebral conjunctiva provides such a direct view of capillary blood, this depletion shows immediately and unmistakably in the color of the inner eyelid. The causes of low hemoglobin, which is called anemia, divide into three broad categories. The first is insufficient production of red blood cells or hemoglobin, most commonly from iron deficiency, B12 deficiency, or folate deficiency. The second is accelerated destruction of red blood cells, which occurs in certain immune conditions and inherited disorders. The third is blood loss, either obvious through bleeding or hidden through chronic slow blood loss from the digestive system, which is the form most commonly missed in people over 60. Iron-deficiency anemia in people over 60 is frequently not caused by inadequate dietary iron intake. It is frequently caused by chronic occult blood loss from the gastrointestinal tract. Occult means hidden, not visible to the naked eye. Small amounts of blood lost daily from a polyp, an ulcer, early colorectal cancer, or chronic use of anti-inflammatory medications that damage the stomach lining accumulate over months until the iron stores are depleted and hemoglobin falls. The person feels progressively more tired and cold and breathless. They attribute it to age. Their eyelid has been pale for months. And the cause, which may include an early colorectal cancer that is entirely treatable at this stage, has not been identified because nobody looked at the eyelid and nobody connected the dots. Dorothy's anemia turned out to be caused by iron deficiency from chronic occult blood loss. A colonoscopy identified a large polyp that had been bleeding slowly for months. It was removed. It was not cancerous. But the pathology showed precancerous changes. Found 3 months later, the outcome could have been very different. Her eyelid told the story that her tiredness, her cold hands, and her breathlessness had been telling for 7 months without being read. Subscribe to Dr. Miller and hit the like button. What I just described, the chain from pale eyelid to iron deficiency anemia to hidden gastrointestinal blood loss to precancerous polyp, is not a rare or exotic clinical sequence. It is one of the most common presentations of colorectal cancer in people over 60, and one of the most frequently delayed diagnoses because the early symptoms are so easily attributed to aging. This channel exists to give you the framework to recognize the signal before the disease advances. Hit subscribe. Every subscriber means the next person with this question finds the real answer. The second finding is jaundice, the yellowing of the conjunctiva that signals elevated bilirubin in the blood. Bilirubin is the yellow breakdown product of hemoglobin that forms when old red blood cells are destroyed. Normally, it is cleared by the liver, converted to bile, and excreted. When the liver is failing to clear it adequately, bilirubin accumulates in the blood and deposits in tissues throughout the body, most visibly in the whites of the eyes and the conjunctiva, which are among the first places yellowing appears because the tissue is thin and white, and the yellow staining shows clearly against it. Yellowing of the inner eyelid and the whites of the eyes, a finding called scleral icterus or conjunctival icterus, is not a subtle finding. When it is present, it is visible without magnification and without equipment. It indicates that bilirubin is elevated at a level that the liver cannot manage, and the causes of this range from acute hepatitis to gallstone obstruction of the bile duct to liver failure to, in some presentations, a rapid breakdown of red blood cells producing more bilirubin than the liver can process. Any yellow tinge in the inner eyelid or the whites of the eyes that was not there before particularly when accompanied by dark urine, pale stools, or discomfort in the upper right abdomen, is a finding that warrants same-day medical evaluation, not a scheduled appointment in 2 weeks. The same day. The third finding is redness and injection, meaning a conjunctiva that is not merely pink but intensely red with visible small blood vessels across its surface. Localized redness in one eye with irritation, discharge, or a gritty sensation is most commonly conjunctivitis, an infection or inflammation of the conjunctival tissue itself that is unpleasant but not immediately dangerous. However, a deep, diffuse redness of the conjunctiva in both eyes without the typical irritation of infection, particularly when accompanied by headache, visual changes, or a feeling of pressure behind the eyes, can indicate a significant elevation of intracranial or intraocular pressure. Acute angle closure glaucoma, a condition in which the drainage of fluid from inside the eye is suddenly blocked, causing rapid pressure buildup, presents with a red eye and requires emergency treatment within hours to prevent permanent vision loss. Any sudden onset of eye redness with headache, nausea, or vision changes is an emergency, not a reason to wait for an appointment. The fourth finding is the presence of small, bright red spots visible in the conjunctiva, not a diffuse redness, but discrete, sharply defined spots that look like tiny drops of blood beneath the surface. These are called subconjunctival hemorrhages when they involve bleeding under the conjunctiva. A single subconjunctival hemorrhage appearing after coughing, straining, or rubbing the eye is almost always benign, caused by the rupture of a single fragile capillary from the mechanical force, and resolves on its own within 2 weeks without treatment. However, multiple small hemorrhages appearing simultaneously without any obvious mechanical cause, or hemorrhages appearing repeatedly in the same person over a short period, can indicate a coagulation disorder, a platelet problem, or in some cases, a vasculitis, an inflammatory condition affecting the blood vessel walls. This finding, in combination with unusual bruising elsewhere on the body, spontaneous nosebleeds, or bleeding gums, moves from benign to clinically significant and warrants a full blood count including platelet count and coagulation studies. The fifth finding is a pale pink ring or arc appearing at the outer edge of the iris, the colored part of the eye. This finding, called arcus senilis when it appears in older adults, is a deposit of lipid material in the peripheral cornea and is extremely common after the age of 60, present in the majority of people over 70. In people over 60, it is generally considered a normal aging change and does not carry the same cardiovascular significance it carries in younger people. However, when it appears before the age of 50, it is a marker of significant hyperlipidemia and elevated cardiovascular risk that warrants immediate investigation of cholesterol and triglyceride levels. If you have this finding and you are under 55, it belongs on your list of things to discuss with your physician at your next appointment. The sixth finding is a change in the color of the sclera, the white of the eye, toward a blue or gray tint. The sclera is normally white. A bluish tint to the sclera, particularly when it appears bilaterally and is not explained by medication or known conditions, can indicate iron deficiency at a level that has produced thinning of the scleral collagen. The same iron that is required for hemoglobin production is also required for the enzymes that synthesize collagen. When iron is severely depleted for a prolonged period, the collagen in the sclera becomes thinner, and the underlying dark tissue of the choroid begins to show through, giving the whites of the eyes a bluish or grayish cast. This finding, in combination with pale eyelids, is a strong indicator of significant iron deficiency and should prompt immediate blood work. Now I want to give you the complete self-examination protocol, because the value of everything I have described depends on looking systematically and consistently enough to notice changes over time. Examine both eyes separately. Pull down the lower eyelid of the right eye first, then the left. The examination requires good light, ideally natural daylight from a window, rather than artificial overhead light, which can distort the color perception of the conjunctiva significantly. Stand close to a mirror or hold a mirror at face level. Pull the lower lid down gently with the pad of your index finger, not the tip of a nail, and hold it down long enough to look carefully at the color of the exposed tissue. You are looking for deep pink or red, which is normal, pale pink or white, which is not, yellow tinting, red spots, and significant asymmetry between the two eyes. Take a photograph once a month. The camera on a standard phone in good light captures conjunctival color with sufficient accuracy to create a visual record. A photograph taken monthly over 6 months creates a timeline that can show gradual changes that the eye-to-mirror comparison misses because the change is too slow to perceive in real time. If you bring that 6-month photographic record to a physician, it is considerably more useful than a single current observation. The specific findings that should prompt you to seek evaluation without delay are these: a conjunctiva that is pale pink or white, particularly with associated fatigue, breathlessness, or cold extremities; any yellow tinging of the conjunctiva or sclera; sudden onset redness with headache or visual changes; multiple small red spots appearing without a mechanical cause; and significant asymmetry between the two eyes in any of these findings. These are not emergency room presentations in most cases, but they are same-day or next-day phone calls to your physician, not things to observe and see whether they improve on their own. How old are you? Write it in the comments right now. I want to see the age range of this audience because it determines what I cover next. If the majority of you are in your 60s, I want to go deeper on the connection between the eyelid findings and thyroid disease because hypothyroidism produces a distinctive set of eyelid and periorbital changes that are almost never discussed in the context of self-examination and that frequently precede the blood test findings by months. If many of you are in your 70s, I want to address the specific eyelid changes associated with cardiovascular medication effects because several of the most commonly prescribed cardiac drugs produce changes in the conjunctiva and sclera that patients are never told to watch for. Dorothy came back to see me 3 months after her colonoscopy. Her iron had been replaced. Her hemoglobin was 11.8. Not yet fully normal, but on a clear upward trajectory. She told me that she had not realized how impaired she had been until she began to recover. The morning heaviness she had assumed was her new normal was gone. She was climbing stairs without stopping. She was warm. She said that looking back, she could identify the moment the fatigue had begun, and she had simply decided it was aging. It was not aging. It was a slow bleed that had been stealing her iron for months while her eyelid broadcast the consequence in a color anyone could have read. Nobody looked. Now you know to look. I am Dr. David Miller, and I have spent 15 years watching patients describe symptoms for months, sometimes years, that were clearly visible on examination before any investigation was ordered, because the examination had not been done carefully enough. The inner eyelid is 30 seconds of your morning. It is a tissue designed by the structure of the human body to be legible, to show you what the blood is doing, to give you information that requires no technology and no appointment to access. Use it. Subscribe to Dr. Miller. Hit the like button. Share this with someone who has been tired for months and has decided it is simply age. It may not be age. Their eyelid may already be showing them what it is. The healthcare system generates revenue from treating conditions that have advanced. I generate this channel so that you see the signal while something can still be done simply. Subscribe if that difference matters to you. This content is educational in nature and does not constitute personalized medical advice. If you observe any of the findings described in this video, please contact your physician promptly for appropriate evaluation. The observations described here are clinical prompts, not diagnoses, and require professional assessment to interpret correctly in the context of your individual health history.